In this video, we're going to be doing wrist flexion and extension goniometry. So to begin with, we want our patient in short sitting. We want the shoulder abducted out to 90 degrees and the elbow also flexed to 90 degrees. For the home purposes, I added the lap table in order to have our patient in the 90-degree abduction angle. We also want our patient to have their wrist hanging off of the table. That way there we can move it through the full range without any obstructions. So to begin with, we're going to start with flexion. So to align ourselves with the goniometer, we want the fulcrum aligned with the triquetrum. So that's going to be your most lateral and proximal carpal bone. If you have a hard time finding it, you could find your ulnar styloid process, keep following it up, and it's going to be a little bit of a dip, and then that next protrusion is going to be the triquetrum. So that's where our fulcrum is getting aligned. Next is going to be our stationary or our proximal arm. That's going to be in line with midline of the forearm. We also use the olecranon process, which is going to be your elbow right here, as reference point to align it with. And next is going to be our distal or moving arm, and that's going to be in line with the fifth metacarpal. So we're going to begin by taking our patient passively through that full range of motion. We're getting a feel for the end feel and approximating how many degrees of motion we see. So this patient has a normal end feel, which is firm, and it looks like he's getting about 90 degrees. Normal would be 0 to 80, so it looks like he might have a little bit more than normal. All right, so we're going to align ourselves up, feeling for some landmarks. I'm going to bring them passively through. And when we bring them passively through, we want to be pushing on the dorsal aspect of the third metacarpal, and that's going to provide the best even force. And we also want the patient to be having their fingers straight in both flexion and extension. That way they're not curling their fingers and getting any extra motion. We want them pretty straight as they can be. Alright, and as expected, this patient's getting about 90 degrees. He's actually getting 93 degrees of wrist flexion. Alright, and next we're going to be doing wrist extension. Good thing is that patient position and all of our landmarks remain the same for this. The one major difference is that we're going to be providing even pressure across the palmar surface of the hand as opposed to the dorsal aspect of the hand. We again want to be stabilizing at the forearm against any pronation or supination, and we want to be watching for any radial or ulnar deviation. So we're going to go ahead and get our goniometer ready. I'm going to bring them passively through the motion. Normal end feel is firm, and normal range of motion for a wrist extension is also going to be 0 to 70. It looks like he's getting about 70 degrees, so we will see where he's falling. Alright, so we're feeling again for our landmarks. Alright, and relax. And our patient is getting just shy of 70. He's getting 69 degrees of wrist extension. All right, so that is wrist flexion and extension goniometry.